उनको बोलो वो माला का। Pranam and Namaskar. And we are very fortunate today that we are having Reverend Shri Sathya Madhusudan Sai, and we are going to have a heart-to-heart interaction with him. So the program is that Honorable Director Sir will welcome Guruji, and then we shall have an introduction by Dr. Satish Babu about the good things which are being done, and have a welcome address by Director Sir, felicitation, and then we shall have the event which we are waiting for, a spiritual talk about service and excellence in healthcare. So now it is my pleasant duty to ask Honorable Director Dr. M. Srinivas sir to felicitate our chief guest today with the garland, that is the traditional Indian way. And like our Indian hospitality and culture, we welcome Dean sir. Dr. Vajpayee, please come on the stage. And I will now request the dignitaries that if we can please have the invocation for Saraswati Vandana before we start any good thing. We always invoke the blessings of Ma Saraswati. Saloni?
धवना या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्कर प्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा ब्रह्म विचारसार परमा आद्यां जगद्व्यापिनीम् वीणापुस्तकधारिणीम् अभयदा जाड्यान्धकारापहा हस्ते स्फाटिकमालिकां विदधतीम् पद्मासने संस्थितां वन्दे तां परमेश्वरीं भगवतीम् बुद्धिप्रदां शारदाम्
Reverend Sadguru, Pranam, respected teachers, faculty members, the various staff members and others of the AIIMS. On behalf of all of this, we welcome you to AIIMS New Delhi, sir. Just now we discussed during the MOU celebration, the signing off, that how it is very important that being the number one in this country for various, whether it's patient care, teaching, learning, research, administration, good governance, that component of the spirituality and the compassion which you spoke about is something that we look forward to see, that we get the hand-holding and the blessings from your side. And it will be a wonderful occasion for us. And then it will be a great moment for all of us that we collaborate together on this aspect so that there is a free flow of collaboration between the two institutions, and we will definitely get benefit of that component which you said, that it's very important to make us the good human being, good doctor, and that's something which is very important for all of us to become excellent. With this, I once again welcome Sadhguru to AIIMS and looking forward to hear from you, sir. Thank you.
Thank you, sir, for your nice words and for setting the context of today's event in the right perspective, because we were just having an interaction with Guruji while the MOU was being signed, and he said very nice things. That is, that medicine or healthcare should be practiced both with compassion and competence, and many times tertiary referral state-of-the-art hospitals do have competence, but maybe they need more of compassion. And then young students who are coming from what we can say is a poor social capital or marginalized, where there is less access and outreach to healthcare, their compassion may be in abundance, but they need support for competence. So if these two themes are joined together, then individual excellence can lead to collective excellence, and that can be a game changer. At least India can take the lead in this. Now it is my pleasant duty to welcome Dr. Satish Babu, who is an endocrinologist in Bengaluru and also very much associated with Shri Sathya Sai University, Medical University, which is the first university in the world to start free medical education, which is a great model, including in India and also in 4 or 5 countries internationally. So I welcome Dr. Satish. Please start the presentation.
Thank you, Professor Kaushal. Namaste, good evening. My hearty pranams at Sadhguru's lotus feet. Respected Director Sir, Dean Sir, and Professor Kaushal, faculty from AIIMS, students, and doctors who have come from outside AIIMS. Namaste to all of you. So without wasting much time, AIIMS, you know, it's a premier institute, and we experienced this during the COVID time. We got regular protocols, guidelines. So you can imagine it's a nerve center for the nation in dealing with health-related issues. And I profusely thank our director for making this historic event happen. I just mentioned 4 days back that Sadhguru is coming to meet President, and he immediately, spontaneously said, because of his goodness, he said, can we have one interactive session on the works and on the spiritual aspect of healthcare in AIIMS, and this is how it has turned out, and we are here today to give a overall picture very quickly. In a way, AIIMS and Satsai Healthcare Mission is connected right from long years. In fact, 1956, the AIIMS was established, and first medical facility in Puttaparthi was established by Baba as a general hospital, particularly for mother and child care in 1956. And in 1991, you all know, super specialty hospital, free of cost, first time in a remote village, making accessible to marginalized societies was the manifestation of Baba's love. Then director Dr. Venugopal was the first surgeon to do an art surgery there, and he kept on supporting and made the hospital, gave hospital lot of inputs, and later on the AIIMS superintendent Safai, Dr. Safai became the director. So there is an association. But what happened after 2011 is what I want to stress and bring to your notice. After Baba left the body, 2012, first pediatric cardiac hospital came up in Raipur under the able guidance and divine direction of Sadhguru. And since then, 3 more pediatric cardiac hospitals were added. And in last 10 years, collectively, more than 25,000 pediatric cardiac surgeries, interventions have happened in these 3 hospitals, hospitals put together, and more than 2.5, 2.7 lakh children are treated in outpatient department. In last 2 years, 7 mother and child hospitals have been established across length and breadth of India, and mainly in the tribal and rural areas. Again, COVID made Sadhguru very saddened seeing the plight of rural care, maternal mortality and infant mortality being very high. That focus area he took up, and 7 hospitals have been set up, and we are seeing somewhere around 700 to 800 pregnant mothers every day, with around 100 deliveries happening per day in these hospitals spread over across rural background. Again, how this happened, there was an outreach program, Divine Mother and Child Health Program, which again is brainchild in 2017. This was started to support the primary healthcare system in taking care of pregnant mothers, mainly to prevent anemia and take care of their nutritional requirements, thus preventing maternal morbidity and mortality. So that materialized into mother and child hospitals. In last 3 years, multi-speciality hospital in, again, one of the remote villages in Mudanelli, that is around 150-60 kilometers away from Bangalore, has been established, which as ma'am said, is being converted into a medical college hospital, where we see around 1,000 patients a day, and having all the multi-speciality facilities. A lot of high-end surgeries are happening. This model of primary healthcare to tertiary healthcare, bringing medical education also into an ambit of providing free, so that rural children have an access to medical education, is thought taking Baba's message of healthcare to a next level, which is medical education becoming deburdened from the commerce. And if you ask me, presently even developed world is facing this issue of medical education becoming a very costly affair. So it's a sort of a global answer from Sathya Sai through our Sadguru. This message Dr. Srinivas wanted to be passed on to the faculty, next generation doctors through his own words, Madhusudan Sai. So this program is arranged with those words. I will play a video which gives other aspects also, along with medical aspects of the works which are happening in last 10 years under the guidance of, under the leadership of Sadguru in nutrition and education.
One world, one family. Vasudhaiva Kutumbakam is the only way to make the world better here and now, says Sadguru Sri Madhusudan Sai, a humanitarian, a visionary, a social and spiritual leader who has established several institutions of public service in the last 10 years since 2012. These institutions offer services to the most needy in the fields of nutrition, education, healthcare and socio-care in about 33 countries, absolutely free of all costs.
Identifying the gaps in societal needs and addressing them in a holistic and sustainable manner to create a lasting impact is the approach to service adopted by all the institutions of Sadguru Sri Madhusudan Sai.
Nutrition. The Annapurna Morning Nutrition Program serves healthy morning nutrition to more than 1.2 million school-going children in India and about 5,000 children in 5 other countries overseas.
Eradicating hidden hunger is one of the main goals of Annapurna, and hence a customized micronutrient-rich supplement, Sai Ishwar, is served to children every morning to ensure better attendance and a healthy childhood devoid of wasting or stunting. The vision is to cover 2 million school-going children by 2024-25.
Over the last decade, Annapurna has also served the cause of maternal nutrition and eliminating pregnancy and birth-related issues by providing expecting and lactating mothers with Sai Ishwar, specially customized for their needs.
Education. The need of the hour is an education model that will induce human values into the veins of education to ensure a holistic development of individuals who will cultivate the commitment to serve the society and help to address the manifold issues and needs of our societies.
A practical testimony to implementing the ancient way of education that is based on the molding of wholesome individuals with brilliant heads, compassionate hearts, and competent hands, the 3H formula, is the Sri Sathya Sai Lokaseva Gurukulam group of institutions. These institutions impart integral values-based education to over 5,000 students, both boys and girls, from grade 6 to doctorate programs over 27 campuses in India and at 3 institutions outside India in Australia, Laos, and Nigeria, completely free of all costs.
The institutions are residential edifices set up in naturalistic settings as symbols of majesty and modesty, reminding one about the genuine goals of education, the acquisition of all forms of knowledge being a paragon of virtues and working for the welfare of society.
The higher education wing is the Sri Sathya Sai University for Human Excellence, an institution which empowers young students with the necessary knowledge, skills, and character with only one purpose: serving the society. Thus, every student who passes out of the university joins the alma mater, which itself is a service institution, or posted at any of its other sister organizations based on the need, thus creating a self-sustainable system.
The university is also the only general university that offers courses in fine arts and Vedic and spiritual studies. To promote learning and research in Vedic studies and to disseminate its priceless wisdom to all, the Sri Sathya Sai Lokaseva Veda Gurukulam was set up in the year 2021.
Bharat Rashtra Nirman Vidyarthi Nidhi, an innovative scholarship scheme to improve enrollment and quality of primary school education, was instituted in November 2021 in collaboration with Rashtriya Seva Bharati. In the pilot phase, around 6,000 boys and girls from grade 1 to 6 in the state of Karnataka are receiving this scholarship.
A milestone that will change the future of medical education in India was accomplished by the Sri Sathya Sai University for Human Excellence by the setting up of India's first totally free medical college, Sri Madhusudan Sai Institute of Medical Sciences and Research. The college was inaugurated by the Honorable Prime Minister of India, Mr. Narendra Modi, on 25th March 2023 at Sathya Sai Grama in the village of Muddanahalli in Karnataka.
Governed by the principle of for the rural, of the rural, and by the rural, this medical college will impart totally free medical education to those students who do not have the affordability but have the aptitude for medical sciences and a service bent of mind to use their knowledge and skills for serving others. Apart from education, boarding and lodging will also be given completely free of cost to all students.
The vision of the medical college is to produce capable and compassionate healthcare professionals who will serve the rural geographies of the country where the need is most.
In its initial phase, the institute comprises of one academic cum administrative block, Sri Sathya Sai Rajeshwari Memorial Block, and one teaching hospital, Sri Sathya Sai Sarla Memorial Hospital. The medical college will commence from the academic year starting June 2023. Apart from MBBS, courses in nursing and paramedics will also be offered.
The institute will commence another teaching hospital, a 400-bedded multi-speciality hospital, by the year 2025.
Healthcare. Sri Sathya Sai Sanjeevani Centers for Child Heart Care are the world's largest chain of pediatric cardiac hospitals without billing counters for addressing the global burden of congenital heart diseases. 5 child heart care centers in India at the states of Chhattisgarh, Haryana, Maharashtra, Karnataka, and Telangana. 5 mother and child hospitals in India at the states of Chhattisgarh, Haryana, Maharashtra, Jharkhand, and Uttarakhand. 5 healthcare centers in the countries of Fiji, Suva, Sri Lanka, Patikalo, USA, Clarksdale, and 2 facilities in Nigeria, Ebbe and Imo, offer completely free of cost services to all, with specialized services for children and their mothers, in the spirit of a compassionate healthcare model.
The 5-pronged approach for holistic healthcare adopted by Sanjeevani is cure through the heart care centers, prevention through the Divine Mother and Child Health Program, a health screening program, nutrition through Sai Sure multi-nutrient supplement, advanced human genomic research for congenital heart diseases, healthcare education and training that provide skill development programs for doctors, paramedics, and allied healthcare professionals.
So far, Sanjeevani has trained around 700 students of physiotherapy, 300 students of 26 perfusion technologists, 20 cardiac technologists, and 20 physician assistants. All this has been done totally free of cost to empower the new generation with medical knowledge and practical experience.
At the Sanjeevani hospitals in India, close to 25,000 little hearts have been treated through invasive and non-invasive procedures. Outpatient consultations and screenings have also been performed for over 412,000 children.
Sri Sathya Sai Sarla Memorial Hospital is a multidisciplinary facility at Karnataka with a high dependency inpatient unit providing services to the rural and underprivileged sections of the society. Over 1,000 outpatients and 300 inpatients are taken care every single day, all completely free of cost at this hospital. The Sarla Hospital will serve as the teaching and training hospital for the Free Medical College.
Yet another free healthcare initiative is the Sai Swasthya Wellness Centers, which are being set up in the rural hinterlands of India. By collaborating with the Jan Aushadhi model of the Government of India, these primary healthcare centers dispense medicines free of cost, while the diagnostics are being done by healthcare professionals specially trained for this purpose.
Currently, 4 Sai Swasthya centers have been established across the states of Andhra Pradesh, Telangana, and Karnataka.
In the next 10 years, more than 6,000 centers will be set up across the country at every taluk, and 5,000 young school pass-outs or students pursuing their higher education will be trained to assist patients, thus creating rural employment as well.
12 centers for human development have been set up across 11 countries for conducting several service and spiritual activities.
To take this triple elixir of nutrition, education, and healthcare to the doorsteps of children is a saga of love and service, as several lives are being illumined through these benevolent acts every single day.
So you will all agree with me that this video presentation was a revelation that how much can be done if you have service as the prime motive of your heart, instead of getting into the commerce and commercialization and so-called corporate culture. And the second important thing was the importance for preventive health care. So primary health care, preventive health, and also what we call in physiology promotive health for primordial interventions, because the best medicine is having to take no medicine. So with these words, it is my privilege in all humility to invite Sadguru, Reverend, to please give us his words of wisdom. After that, we will have a very good model of an interactive session also to answer some of the questions which have come from your side. So I please invite sir.
सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखमाप्नुयात्. Warm greetings to everybody and namaste. This prayer is an ancient Indian prayer. I think a prayer of one of its kind, which is found only in a country like India. It says, let everybody be happy. May everyone be healthy. May everybody see good and auspicious things everywhere. May no one have any sorrow. This is the culture of India, where we pray for everyone, not just ourselves. And we do everything to manifest this prayer as service to the needy, whether it is health, whether education, whether it's nutrition, or any other social need or spiritual need that the people may have. So today, it's a momentous day, and I'm sure it's history in making, when we as an institution are joining hands with the topmost institution in healthcare in India, All India Institute of Medical Sciences, New Delhi. And thanks to Dr. Srinivas and the entire team, the dean, the faculty, and everyone else who have worked to make this happen. And definitely it is divinely destined, because that was not on our list of things to do when we came to Delhi. But it somehow formed itself, it got manifested because of the passion of Dr. Srinivas and of course Dr. Satish Babu, who represents our institute. And they both happen to be partners in crime at Bellary Medical School. And that's how they know each other. And now we have a wonderful model coming up here in the south of the Vindhyas, as they say. We have a medical school coming up, which is first of its kind, is completely free of cost. And that is, as you have already seen in the video and been told, it's mainly to ensure that rural children also can get a medical education, who cannot afford to even pay a hostel fee and things like that. They also will be given completely free of cost medical education, nursing as well as paramedical education. And on the other side, this is the All India Institute of Medical Sciences, and I just saw the rankings which came out. Again, it is right on top of the game, and it's been that way for such a long time. And I'm sure it is going to do much better, and it's already in the category of the world's best institutions. And I'm only looking forward to learning a lot from all of you at AIIMS and help build the south of Vindhyas Medical School, which is going to also be a world-class facility for patients as well as for the students. And Dr. Kosha, was very nice of you to recollect the conversation in the boardroom, and which where I mentioned that what two watchwords for healthcare and medical education is competence and compassion. There are a lot of institutions where the commercial aspects become so very important that the compassion is thrown out of the window. The doctors are, of course, they cannot do anything because the private schools, private institutions, the management is for profit, and therefore they have to run the institutions the way they need to run. They borrow, they get investors to invest in the healthcare and run it like a business. So while there is a lot of competence because they are very highly paid, they can attract competent talent, but the compassion part goes missing, which I have seen in many, many institutions around the world because I keep traveling around the world. And on the other side, we have very good institutions or very good children who are very compassionate. They have passion to serve the society, but they fall through the cracks in the system and they do not get an opportunity to get educated, get trained, and become competent to help the society. So the need of the hour is to bring these two together, provide a facility where children can be trained and made into competent healthcare professionals, medical practitioners, and at the same time, they do not lose compassion, which is so very natural to every human being. We are all born compassionate. As we grow, our heart dries up because of the other considerations of the world. Then we lose this touch of compassion, which we always have. So to preserve and promote compassion in the healthcare professionals, at the same time provide an opportunity for them to become very competent medical professionals is the idea of this medical school. And it is a labor of love with a lot of people from around the world participating. As you may understand, building a medical school in India is not a cakewalk for sure. You have to have a teaching facility, a lot of infrastructure, huge faculty requirements, and at the same time patient clinical load and everything else. So all these our institution has worked towards in the last couple of years to build the first of its kind institution, and we were very fortunate that the Honorable Prime Minister, who appreciated this initiative, and he made it to come to the ashram and inaugurate this facility. So this is in Mudenhalli, around 30 minutes from Bangalore International Airport, and in a very picturesque rural setup. And Dr. Satish Babu comes from the neighboring village, and his father was a farmer, and he studied in our schools long time ago, and he went on to do his medicine, and now he's back after several years in London. He has come back as endocrinologist, and he works with our hospital. Apart from having a private practice, he largely spends all his time at the hospital building the systems, processes, and giving the hospital a direction. So we are very fortunate to have very passionate, very compassionate and passionate people in our hospital, and that's our strength. And today is joining of forces with Dr. Srinivas, who is also equally passionate. As whatever I know of him, you know better, I'm sure. Whatever he has done in his past in terms of turning around, not loss making, but actually almost ventilating hospitals. And he turned them around and brought them up. And that's a great contribution and a visionary leader. At the same time, all the competence that exists here in this facility, we look forward to borrowing your wisdom and your skills and training the poorest of the poor rural students. And this idea came to us because 6 to 7 years ago, there was a girl who was studying in our 11th standard. And she joined from a rural village, and she studied only in Kannada medium, vernacular. Her father was a cook in our own hostels. So he was given a job, and so he asked for the admission for his daughter, and the daughter was given admission in the 11th, but she could not understand, speak, or read English. At the same time, one day as she was speaking, she said it was her passion to become a doctor. Because she came from the poorest district in Karnataka, something like Mewat over here, no? It's like that, Chamarajnagar district it's called. And there she was telling that she used to see pregnant women being carried in, this bamboo and this bed sheet and things like that to the hospitals, and many times they could not reach the hospitals. And when she saw that, she felt in her heart that she should become a doctor and help the poor rural people. But of course, she had the compassion part of it, but the competence was missing. She could not even read and write in English. Forget about cracking NEET exam and then getting into a good premier medical school for free, like AIIMS. So that was not something that was possible for her. But when she expressed that, we did train her. We helped her get a coaching. She went on to get a seat in Bangalore College, and then she now finished her MBBS, and she's doing her internship right now. But this made us think that we can perhaps 1 or 2 children we can sponsor like this wherever we find. But what about so many more who do not even know about us, but they have a lot of passion? They want to become good doctors. They want to also serve the rural societies. And if they invest a lot of money in getting a degree, which is the case usually, then how are they going to give services to anybody? Because there will be considerations, financial, other aspects will be there. They have to at least earn something back for the investment they have made in medical education. So that is where we thought of how can we solve this problem. And with a lot of well-wishers who joined hands and supported this cause, this is how the medical school has come up. It's been approved. And we even went to the Ministry of Health and asked them that we do not want 100 seats, which we were eligible for. I told I just want 50 seats. And the minister and people were surprised. They said, generally people come and ask you 200 seats for a 100-seat infrastructure, and you are asking for 50 seats. Then I mentioned that we want to train every student, they should be molded correctly, and the character building, culturing, it's very important for us. And most of them come from rural areas, so they will take some time to come up the curve. They're not going to be the same as other students who studied in urban setup. So give us a little time before we can increase the number of seats, but please for now, reduce it to 50. And with a special, act, they reduced the seats to 50 for us. And for this year, we are going to be taking the first batch of 50 students. And most of them are going to be rural students, and many of them girls who have written NEET, and they've all got good marks. And I think NEET results were out yesterday. So why I'm telling you this long story is because as we travel around the country, we see a lot of villages where there are healthcare centers, there are primary healthcare centers, but there are no doctors. There are facilities which are languishing, and many times it's very sad to see that despite government having built these centers and done whatever it needs to do for the villages, they could not place the doctors, both competent and compassionate doctors. And these are just lying vacant. So this made us think if we can create a model where we can inspire students and with no cost for their education, we only request them that they should continue to serve in the rural areas for as many years as they have studied with us. So you do a 5 years MBBS, you do 5 years of rural service. And that's the only cost or whatever, that's the only condition that we have put in. But it also helps them to gain a lot of experience in terms of getting a lot of work to do, and it's paid service, so they will get paid at par with the government scales. And after that, they can also pursue their post-graduation and whatever they want to do in the future. We also, as you see, we also have pediatric heart hospitals. That is a super specialty which takes a long time to acquire. In the sense, in India, it would be anything between 10 to 12 years before you become a good pediatric cardiac surgeon. So that is another thing I would like to talk and work with AIIMS to reduce this training period for pediatric heart surgeons. And in US and other places, in Stanford, there are courses which are 6 years, 7 years, to make you a pediatric heart surgeon. Of course, you should get good training, you should get enough work to do and enough experience. But stretching it too long makes people, not take this specialty. At the same time, in India, more than the data says 300,000 children are born every year with congenital heart diseases. And the total facilities in all the centers are close to 60, majority of them in the south of India again, and very few facilities in the north. So we built facilities in Palwal, Haryana, which is very close to here. And that is a 200-bedded pediatric cardiac hospital, which does both cath interventions as well as open heart surgeries. And similarly, we have in Kharghar, Mumbai, we have in Chhattisgarh, Navaraipur, and we also have this Mudanhalli, Karnataka, and in Telangana too. And we are working closely with state governments to become their referral centers. And when patients come from the state government, we take them and treat them. But our waiting list has gone to 2026, is what I was told recently. This is despite doing almost 30 surgeries and procedures every day. So the idea is that there is a huge need and a huge gap between the healthcare requirements and healthcare providers. And there are many government hospitals which are not sufficiently staffed. There are many private hospitals which are highly unaffordable. And there is a huge gap in between of the people who neither can afford to pay such high costs of medical care, nor they can sort of go to government hospitals and avail this because all the facilities are not available. Especially specialists are not available in rural areas. Chikbalapur, where we come from, the doctor-patient ratio is 1:11,000. And some of the states where we work, like we get patients from UP, even Mewat and other places, 1:30,000, 35,000, Bihar, UP, Odisha. This is the doctor-patient ratio. Or these are also just general doctors, physicians, not specialists. So the gap of rural-urban divide is so huge, And this is just one step to start bridging that gap by training students into good healthcare professionals. So we are very glad and very happy that we could find ways to collaborate with this premier institution. And I'm sure there is much give and take, there is much to learn from each other. The competence, definitely, you have abundance of it, and I'm sure compassion too. And we will learn both aspects from you and how to manage such a huge crowd as yours. And you can imagine if it's a free multi-speciality hospital, you can get a lot of crowd there because they don't even have to pay a rupee to get inside the hospital. So we already are getting a lot of crowd. We will learn from you how to manage specialties better and how to train our students into good doctors who can be anywhere, who can rub shoulders with the best of the specialists around the world. So free model does not mean a low quality model. Our motto is treatment to the poor is not poor treatment. So it should be a high quality treatment. And I tell our staff, if you can admit your father, mother, brother, sister, son or daughter in our hospital, only then I would believe that you're running the hospital well. Otherwise, we know that you're just doing a shoddy job for the sake of poor. So these are the basic principles on which we work. And I feel there is a huge need for infusing values in healthcare, especially values like compassion, service, sacrifice, respect to the colleagues, respect to the patients, whoever comes to the hospital. And above all, a little spiritual value. In our hospitals, we've seen, we allow patients to go to the prayer room and do whatever prayer they want, whichever religion they come from. And that helps a lot in building positive thinking in those patients. And this, all of us intrinsically, we all believe in something. And that belief or that faith gives us the inner strength to go through whatever we have to go through. So that's also infused into the system where a little bit of spirituality is taught and practiced in our hospitals. Every day, all the doctors pray. All the doctors before the surgery, they all meet, discuss, pray, and then go for surgery. And everywhere you will see in our OTs, it's written Sai is the surgeon, which means to say that the divine is the surgeon. We are just the instruments in the hands of the divine to do God's work. I think that culture, if we put it inside our next generation of doctors, will do a lot good to the whole society and in times to come to the whole world. Vaidya Narayana Harihi, doctors are God, physicians are God. This is how our scripture said. And I think we must make that scriptural truth come alive right in front of all of us in every doctor that we train, every nurse or a paramedic. With that vision, we are working. And I'm very, very grateful and very thankful to the entire team at All India Institute of Medical Sciences. And I wish them very well. I know you have very big plans. Dr. Srinivas was showing me a whole new plan for this institution and many, many other centers outside Delhi, which they will be specialty centers, a great model. And I wish you all the very best. And I look forward to working in whatever way we can to help each other. Again, ending with a prayer. Sahanavavatu, sahanau bhunaktu, sahaviryam karvavahi, tejasvinavadhi tamastu, ma vidvishavahi. Which means let us be protected together in this endeavor to learn and teach. Let us enjoy whatever we are learning and teaching. Let us remember whatever we have learned and taught and not forget it. Let us be kind to each other while we are learning and teaching. Let us not be cause of hostility or anguish to each other while we work. And let there be peace. With this idea, let us work hard to building a totally Indian model of healthcare, teaching, training, and patient care, which will become a role model for the entire world. With these words, thanking you all for making your time amidst your busy schedule to come here and listen to us. And I hope to have some interaction. If there are any questions, I would be happy to answer. Thank you very much. Namaste.
Got some questions from the students. So I will start with the first question. Swamiji, how do you define the organization? There are societal aspects of nation building and also spiritual aspects. What is the primary focus?
It's an important question that how we define ourselves. Till a few years ago, we used to call ourselves a spiritual organization which is doing social service. But of late, we have redefined ourselves as a social service organization founded on spiritual principles. So that is the totally new way of looking at things. And we believe spirituality's true expression is in service. You can't be loving God and not love people around you. You can't be wanting to serve God and not serve the poor and the needy. So the new age spirituality to us is service. And therefore, our organization is now a social service organization founded on the principles of spirituality, which is to love everyone and serve everyone because we are all divine. That's the idea.
Thank you very much. I think you all will agree with us that today Sadhguruji has increased the spiritual quotient and invoked the spirituality which is latent in each person on this planet Earth. And if I may ask you another question, Swamiji, it is heartening to see the scale, intensity, and consistency of societal welfare work happening in the last 10 years. Where do you see the organization in the next 10 years?
It's a very difficult question because when we started 10 years ago, we did not know that we are going to be here. I have to be honest and frank. If somebody thinks we had the vision to be here today, I don't think. But what we did is that we kept on reinventing ourselves based on the need of the society. For instance, mother and child hospitals came up, which were not a part of the original program because of the need that we felt when there saw a lot of infant mortality and maternal mortality, especially in the rural areas, for very silly reasons, which could have been easily avoided. So that is where we started. Now we came to the medical college after COVID and the Ukraine crisis that happened. A lot of our students go study abroad. So this medical school was an afterthought of that crisis as well. So where we will be in the next 10 years, I do not know, but at least some fair idea, if I have to give you from whatever I understand, is we want to be in every district of the country as an educational institution where we have one role model kind of a school in every district of the country from where other schools can borrow ideas, learn, and this school becomes like a nerve center for reviving the education system of India, which again is to inculcate values into children, bring a sense of pride in our culture and heritage, and also make them very competent professionals in the coming times. So that is one thing. On the healthcare side, we have built 5 super specialty hospitals right now. We want to build another 5. And medical school, we have built 1. But my view is that if not in 10 years, in a couple of years later, we should have 5 medical schools in the east, west, north, south, and the center of the country, so that children from those regional areas can access education closer to their houses and go back to their places in rural areas to serve. So that would be our vision on the medical side, which will take a while, I know, but it will happen. And on the nutrition side, our motto is very clear: let no child go to school hungry ever. So that spells it for us. That till we reach every single child in the country through various programs, governmental, private, with other organizations, we will not rest. I do not see how can we call ourselves a civilized society or a developed nation if our child, the most vulnerable member of our society, cannot even afford a breakfast in the morning every day. I do not see how we can ever call our nation as a good nation. So I think that would be our parameter to judge whether we are doing well as a country, as a society. So these are the areas. Of course, spiritual centers are coming up. That's a part of this. Not everybody needs health, education, or nutrition. There are well-to-do people as well, but they need spirituality to lead a better life. So even that is going to be a major thrust in every center.
Thank you, sir. And as sir said, that feeding the body, feeding the mind, healing the body and mind, and most importantly, healing souls. We have many fractured and ruptured minds and souls by the stress of modern living and commercialization. It is said that in the West, there is a saying that not even a flower blooms there without somebody getting a commercial benefit from there. And from our East, we have to redeem and revisit the paradigms we lost in serving healthcare with spiritual motive in mind. So, sir, my third question would be, the key mantras in corporate world, from where I come from, scalability is one, which I'm quite impressed. The question of sustainability comes next, especially when everything is free of cost, which is almost impossible in the world where we work. What is your opinion on this, and what is the model? Can you please share with us?
That's a trade secret. But how do we run free and then still we run it well and still we continue to run without and expand and grow? It's truly a divine. If I have to be honest, it's a divine grace that makes it happen. But that divine grace flows to those who are very selfless, who are pure, whose only intention is to do good. God stands by their side. That is the spiritual truth of this. But let me give a more practical, worldly or societal explanation. I think what we have done over a period of time is that we have worked very closely with several organizations. Now we are working closely with government as well. Ayushman Bharat is there. Many state health schemes are there. You signed MOUs with almost every state for pediatric heart care, where they refer the patients to us and then we do the work and whatever reimbursements happen. So that is a part of the reimbursements. We work with pharmaceutical companies to reduce the cost of drugs and consumables at a lower cost so that also reduces. Lot of volunteerism in our hospital. If you come, you will see, I think almost 30% of the staff there working voluntarily. These are surgeons, which are very, very accomplished surgeons, but they have had their time, abroad or somewhere in big institutions. Now they want to give back. So they're all part of this institution. Our director of this medical school is actually our own alumni who studied 50 years ago in one of those erstwhile schools. He was the very first doctor that our institution ever produced. He went on to do, he is a pathologist, and he was in Bangalore Medical College. After retirement, he joined us as a director. So these are all ways we have reduced the cost. At the same time, on education, health, we have wonderful programs for people to participate, and people from around the world are supporting this. And I travel a lot, I meet a lot of people like you, and I kind of encourage them to join hands, to share their skills, knowledge, and resources. And that is how these institutions are running for free. But above all, I think sustainability is not just about financial resources. It's also about the right kind of people, the next generation, the succession planning, bringing up the next set of leaders. That keeps the organizations healthy and running for a long, long time. So we are working very hard in bringing up the next generation of leaders who are equally capable or even better. And they will run it much better than us. So Jana and Dhana, two sides of sustainability. Dhana aspect, as I mentioned to you, a lot of effort goes there. And Jana aspect, we put a lot of effort in bringing up the next generation, molding them and inspiring them to join. A lot of youngsters, our university has produced, in the last 5 years, we just there for 5 years. And the first batch of convocation, probably we had 100 graduates who came out. All of them joined us back in our institutions as interns, as volunteers, or as teachers, while they were also pursuing their post-graduation. Even after post-graduation, 40 of them has joined us back. And now they're pursuing their research. So the idea is that we bring back our people into institutions, and same thing we want to do with our medical school. So these are the two aspects of sustainability. But above all, I think this principle of selfless love and service, which is blessed by God, and that is the real strength, that is the core secret, how we are able to grow and expand.
Thank you, sir, very much. And corporate social responsibility, as we know, could be just 2 to 5%. And the culture of the Swand, or giving 1/10 of our income back to society, yes, that is another good concept. It is also there in the West, where it is called tending. And we have newspapers which run just on the ad revenue. And therefore, the same kind of model can be used so that the healthcare workers don't have to worry about the money part, and so also the healthcare consumer. So we believe and we compliment your bright and model and the brilliance behind it, as well as the spiritual motto behind it. So if you allow, I'll come to the next question. Swamiji, the world we live in is quite demanding and competitive, more so when you are the lead of a conglomerate or a sporting personality or a celebrity. Swamiji, how to maintain balance of work, family life, personal life, and a step towards journey for spiritual consciousness too?
This is a question asked very often, that how do I balance my work-life balance, family, then also spend time on spiritual development and growth. And I don't find time to do everything altogether. But I feel that if we are doing what we love to do, our life will automatically get calibrated and balanced. You never feel that you're doing injustice to any aspect of your life. The first and foremost thing that one should do is to do what they really, really love to do. They never feel tired. They never feel burdened. They never feel exhausted. Now you are there, some of you are, I'm sure, passionate surgeons and residents, and you would be going, you can go on for, I'm sure, 2 days at a stretch, and not as a burden, as an effort. Physically, it might be exhausting, but mentally, you're excited. So I tell people, first you do what you love to do, and don't go simply because you will earn more by doing this or earn less by doing that. You simply go by doing what you love to do. You want to be a sportsman, be a sportsman. You will never be tired of being a sportsman, and you will never have work-life balance issues. You will always be able to love your home, family, also dedicate or devote your time for any other activity, because you're always at peace. And that peace is the key for our balance in life. When we lose that peace, we lose balance. And peace comes when we are exactly doing what we are born to do. We are fulfilling the purpose for which we are here. And I'm sure even if you work at a stretch, your family understands, then you yourself grow in your own spiritual way also. So I think the best thing to do is to encourage children to pick up their professions according to their passion, and not fit the profession or passion into the profession. That doesn't happen. I've seen a lot of IT professionals, especially in Karnataka, which is the Silicon Valley, Bangalore. A lot of IT professionals quit after COVID. And you know what they're doing today? You would think that they might have started their own startups and some IT companies and things like that. No, they're going and doing farming. They've opened goshalas. They've gone back to their father's farms, and they're growing organic food, and they're selling it online. And these are all those coders and software professionals who are earning, in 7 digits. They all have gone back doing things. And when we ask them why, it's only because they were not happy doing what they were doing. And COVID gave them the much necessary pause. And they kind of thought what they were doing with their lives, and went back and doing good things. So I do not know where were they more balanced, as agriculturists now, which is what was their DNA, or as software engineers, which was just a mutation, I think. So they're very happy doing what they're doing. So idea is that when we do what we love to do, balance of mind comes. In that balance of mind, everything else gets balanced.
Thank you, Swamiji. We all, I think, ascribe to the idea that harmony and balance and melding ourselves to our intuitive consciousness and will engender and foster our spirituality, which was always there, but may have gone to some lower layer or some liminal place in our subconsciousness. And to the WHO theme is also to build back better and connect with Mother Earth and connect with nature, connect with gardens and greenery, and that gives you a lasting sense of peace. And once you are at peace, as we say, physician, first heal thyself and then go out and heal the world. Thank you, sir. So just one last question. What would be your future plans for schools and medical educational colleges?
As I already mentioned in a short way, I think we should have one school like our school in every district of the country to begin with. That should be the role model for all other schools to borrow from. But that needs a lot of effort, not just in building the infrastructure or getting the land, but actually creating the next generation of teachers. The teachers are the soul of any educational institutions. In the last 30, 40 years, the kind of apathy towards teaching profession that has been created by collectively by parents, by teachers themselves who do not want their children to be teachers, and by the governmental policies and everything, we have no teachers left in the society for the teaching the next generation. But every day we have 70, 80,000 children being born who all have to go to school. But there are no proper teachers. Even if there are people who are teachers, they are not passionate. So I think we are working on building teachers through our university. And when I have enough teachers that I can deploy at least one of them to every district school, I think we will be there in every district. And for the healthcare also the same thing applies. We have lost a good set of doctors to the other countries, richly paying countries. And that brain drain has caused us a great deal. And I was in the US and I was told that in this decade, almost 6 lakh doctors in US are going to retire. And where they are going to get the next set of doctors? They're all going to come from Asia. They will all go and settle down in the US because US is going to make it very easy for them to come to US if you're a medical professional. And that's going to be another huge dent on our healthcare system. So unless we have doctors who are not just competent but are passionate to serve, they will not stay back in the country and do. So our idea is again on the healthcare side, create the right kind of personnel, human resources, who will stay back and serve the country. And once we have enough of these doctors, we'll expand to more hospitals and more healthcare centers. That's the main theme. Building people is the main agenda.
Thank you very much, sir. And I think the audience, you should also applaud the doctors who didn't go
Yeah, I should clap for all of you who stayed back at
and are
Master.
sitting here. Dr. Satish Babu, Dr. Girija Rath, Dr. Sanjay Lalwani, Dr. Rajkumar Yadav, Professor Sanjay Vadwa. They are also part of our AIIMS Medical Humanities Initiative. Dr. Malhi here, Dr. Rakesh Upadhyay from BHU, Dr. Ramam sitting at the back, Dr. Anju Dhawan there. So they are all part of our work culture
wonderful.
here. And because an institution is built up with minds with commitment and passion and dedication.
Absolutely. A pleasure meeting all of you. There is still hope. That's what I found after coming here.
Director, sir, we are reaching the end of our program. So I would like you to felicitate Sadhguruji with our institute memento, which is our ritual and culture.
Sure.
Dr. Ramam and Anjuji, आप आ जाइए.